7 things you need to know about PCOS. Polycystic ovarian syndrome is a common hormonal disorder that affects an estimated 10 to 12% of women in the US of childbearing age. Our recent study shows that this number might be much higher here in Trinidad and Tobago, and this can be reflected across the Caribbean. Polycystic ovarian syndrome is best managed when you have the right amount of knowledge and support to help manage your specific symptoms. As a gynecologist, I believe it's important to know some facts about PCOS. So here are 7 things you need to know. Number 1, PCOS is a combination of some physical features that are quite common. Irregular periods is one of the hallmark characteristics of polycystic ovarian syndrome, which is caused by elevated levels of male hormones called androgens. You may also have excessive or unwanted weight gain. You may have excessive facial hair growth along the chin, the upper lip, the chest, the upper body. Facial acne, body acne, and oily skin are also features as well. And hair loss or hair loss from the scalp, thinning of the hairs, another feature, as well as dark pigmented skin around the neck area, the armpit, under the breast, and in the groin, and growth of skin tags around the neck and armpit areas. Number 2, PCOS may have multiple causes. So yes, there are elevated male hormone levels called androgens with PCOS, but you can also have insulin resistance, where insulin, which is the hormone that our body produces in the pancreas to change our food into fuel, is actually not working in your body well. The cells of your muscles and so forth are resistant to your own insulin production, so your sugar levels in your blood remain elevated. This then creates the need for more insulin production, but because there's a resistance, you end up with an elevated or excess amount of insulin in your body, which causes higher male hormone levels, as well as skin changes such as acanthosis nigricans, where you have darker pigmented skin along the neck, armpit, under the arms, and in the groin. Number 3, the third thing you need to know about PCOS is that there are different types of PCOS. So there's insulin resistance PCOS. There's also inflammatory PCOS, where different toxic factors or environmental factors, stress factors, or inflammatory foods such as gluten may trigger elevated levels of male hormone production in your body, which causes the symptoms of polycystic ovarian syndrome. Another type of PCOS is called post-pill PCOS, where after being on oral hormonal contraceptives, and you come off of them, your ovaries produce an excessive amount of male hormones, which produces the symptoms of PCOS. The 4th known type of PCOS is called adrenal PCOS, where it's not insulin resistant, it's not an inflammatory trigger, it's not post-pill, but your adrenal glands don't respond well to levels of high stress and are producing excessive amounts of male hormones that cause PCOS symptoms. The 4th thing you should know about PCOS is that some women may be more prone to developing PCOS. Excessive body weight or your mother or sister having PCOS does increase your risk of having PCOS as well. The 5th thing to know about PCOS is the most common reason for having a fertility issue or difficulty getting pregnant. Now, many women with PCOS conceive naturally with no issue. However, within women who deal with infertility, PCOS is one of the most common reasons why they may not be getting pregnant. PCOS can also increase pregnancy risks, such as gestational diabetes, pregnancy-induced high blood pressure or preeclampsia, risk of premature birth, increased risk of needing a cesarean section, and there is an established 1/3 increased risk of miscarriage in women with PCOS. The thing that you should know about PCOS, which is number 6, is that PCOS can increase your risk of long-term health problems, such as excessive weight gain, type 2 diabetes and metabolic syndrome, obstructive sleep apnea. Excessive body weight can lead to heart disease, high blood pressure, depression and anxiety are linked to PCOS as well too. and endometrial hyperplasia, which is a change within the cells that line the womb after years of prolonged irregular bleeding. These cells can transform later on to become a cancer in the womb, and that risk is associated with polycystic ovarian syndrome as well. Number 7, the seventh thing you should know about PCOS is that there's no single test for this condition. Confirming a diagnosis of PCOS usually is a multiple step process where you would need to undergo a few things to determine if you have it and then what form of PCOS you may have. This will include a detailed health and medical history and family history, a pelvic ultrasound to evaluate the ovaries, blood testing to check hormonal blood levels, and a physical exam. Once we've established the diagnosis and can pin down the type of PCOS you may have, treatments and lifestyle modifications can allow you to just learn to live with a better profile of PCOS management.